Good afternoon, dear colleagues, journalists. I thank everyone who came here today. The topic of our presentation is presentation of analytical report. So this is presentation of analytical report on the results of procurement of drugs for cancer patients by international organizations and local hospitals in 2016. Our organization, the Anti-Corruption Action Center, monitors public procurement, and each year we represent a report, and in this report we state what works and what doesn't. So what we see now, what we analyzed two things. First, the efficiency of procurement by international organizations and compared it with the procurement by the ministry, and also the organizations such as Crown Agency bought in 2015, and in 2016 UNDP bought these medicines for oncology patients, and we compared the procurement by the ministry, then the Crown Agency and UNDP, and what we've noticed that Ukrainian local institutions, they use the same schemes as which were used at the central level. So Prozoro system works in situations when chief doctors really want to buy cheaper. Then the Prozoro system is the ideal mechanism. So you can reduce the price and you can do it in an efficient way. For example, we may remind the prices that were used by the Institute of Cancer, and two national hospitals made these procurements last year. So we saw in the regions that the majority of schemes that existed at the national level that we described in 2013 and 2014, these schemes shifted to the local level. So this is the overall number of money that was allocated, and now we have a lot of questions about delivery, and these are 80% of supply, and we made requests, and the majority of medicines were supplied. So the money was saved, and now they have new procurements with the use of these funds. So we compared the number of drugs that were bought in 2015, 2016. So they additionally bought 31 drugs this year, and we have problems with the supply. If we are speaking about international organizations, and what we see, it is connected with the fact that international organizations do not know who will win the tender. So in 2014, sometimes in a month, they supplied medicines earlier, and first they just negotiated with the suppliers, and they can order the whole batch of drugs, and now we see the same situation at the regional level. And in our report there are examples. We compared this with regional procurement, when, for example, they demand to supply drugs within 6 hours, or they just ask for immediate delivery. So it is impossible to deliver 50 items within such a short period of time. So the pharmacy that is located in the hospital wins the tender, and the co-owner of this pharmacy is the chief doctor of this institution. So in technical specifications, they provide such things that reduce all this to some supplier or some particular producer. So if we compare procurement between local and hospitals and international organizations, only 3% were bought by the ministry and 57% by international organizations. So 3%, these were producers, and then there were distributors, and now we have 57 of producers and 47 of distributors. And if we look so the producers do not want to enter directly. There are some instances, but they are rare. And also, I think that direct supply from producers, it provided a decrease of the price. So we compared the prices. We've compared the prices of the ministry and the UNDP in 2014, 52% of the saving, and in adult oncology, and 27 saving in children's oncology. And also in our report, we stated that some of the drugs are ordered by doctors, and these drugs are not needed in such a big quantity, and they remain unused. And so the saving in oncology, it is really big. So we counted non-proprietary name drugs, and here there is big competition. The example of Minitinib, this is a drug to treat blood cancer, and one pill cost $90 per pill, and now it is $2 per pill. And this is a generic drug now that we bought. So children's oncology here, they buy brand names. They are afraid of generics in this area. So if we don't have competition, we do not have a decrease of price, but there is saving because they buy directly from producers, and also assortment of drugs was broadened. And also example of competition, speaking about the figures we've shown. So this is page 15 of our report. So we see here Imatinib 96, 1.43. So the difference is just huge. And if we look in the regions, so there is a lobby of pharmaceutical industry. And if we compare 2015-2016, the majority of medicines were bought at a lower price, and this shows the trend. People start to trust international organizations, and producers are ready to decrease the price and to conclude contracts directly with the and to avoid distributors. So here we've shown that we were able to reduce the price significantly. If we are speaking about regional procurement, all those examples that I've mentioned, so here are the examples, and some drugs were bought 400% higher price. So so here we have mentioned that if there is competition, so the medicines, they become 3 or 4 times less expensive. Also, I would like to focus on one more important issue. This is the pressure from law enforcement bodies. For a long time, we were trying to understand why international procurements worked, and maybe it is weird, but first of all, this reform succeeded because the majority of procedures, mainly all the procedures, were outside the legal sphere, legal sphere of Ukraine. So if someone tried to act, so people from law enforcement officers came, or they blocked these actions through anti-monopoly committee. And only one program that was not handed over from ministry to to international organizations is the program Vitalii, and the procedures are blocked by the Anti-Monopoly Commission, and also some distributors also wanted to block these actions, and law enforcement bodies of Ukraine cannot pressure international organizations, and this allows efficient implementation of this reform. So we analyzed information from available sources. All law enforcement bodies except NABU opened cases against the Ministry of Healthcare concerning procurements, and what was the basis of this these prosecutions. So these were the requests of people's deputies, and special prosecutor's office, they found some information from the article from the internet and started a case based on this article. So if someone would write something on the wall, maybe they would also open the case because of this information. So so they use the same logic, these prosecutors of when they opened the case, but then this article was removed from the site. And what happened this year, they started several cases were started by Prosecutor's General Office, and for a long time they analyzed the process of international procurement, whether concerning, and they published the report, 40-page report, authored by Mr. Witwicki. This is the advisor of Prosecutors General, and he published a report that all the grounds for opening the cases, this is so all these cases, they do not have legal grounds. So we have such a deputy, Mr. Vinnik, and he wrote a claim to the prosecutor's office, and he said that they buy medicines through that UNDP buys medicines from Metro Cash and Carry, and Prosecutor's General Office starts criminal procedures and enters this case to the single registry, and we had several meetings, and they asked us about international procurement, and we tried to explain what is going on, and they said, why can't we verify the activity? So when we see the verifications carried out by our law enforcers when they come to pharmaceutical companies, so then after this, confidential information is leaked out. So they wanted to get access because they didn't know for the first time what are the proposals, and they did not know whom to block in order to let someone else to win. So no one could know this information, and before this, tenders in HIV, in AIDS, and so they were managed by one company. Now we don't have this, and our law enforcement bodies still open cases, but international procurement works because these organizations cannot be blocked. You cannot leak this confidential information. UNDP is a diplomatic structure, and you cannot carry out searches there. And also, there are some conclusions of Prosecutor's General Office to understand the cynicism. So they provided conclusion that international procurement really works, but then Kiev Prosecutor's Office opened the case. They didn't listen to the Prosecutor's General Office, and then Specialized Prosecutor's Office opened the case. So separately, we should note the pressure from the side of SBU. Maybe you know about pressure on pharmaceutical business, but the pressure on international organizations and the Ministry of Healthcare, this happened for the first time. SBU wrote letters to international organizations. They wrote letters to the Prime Minister. They wrote letters to the Ministry of Healthcare. They said, why are you broadening this? Why do you extend this list of medicines? And they wrote in official letters that this is all done for one producer, and they stated that this is done like this concerning 17 types of medicines. And you know that this was weird, and the representatives of SBU, they summoned people for interrogation. They tried to do everything possible in order to show that international organizations are inefficient, and that this broadening of the number of medicines, that they believe that this is corruption, and that these drugs may be of low quality. And we had a meeting with the representatives of SBU, and we asked them, did you write the application to the state service? You should inform that you have suspicion that these drugs can be bad, and they said no. So you should write to the Prime Minister, to the Minister of Healthcare, and you should publish this officially. And they couldn't answer to this. And also the pressure from deputies. So this is the main. So they try to kill reform. They say that they buy for a higher price, or they buy something that is useless. So they say that we should procure through Ukrainian legislation. But international procurement, it is efficient because it is outside Ukraine's legislation. So we understand that when it will be done in the framework of Ukrainian legislation through Prozoro, so the Anti-Monopoly Committee can block any procedure. If it will work, if it works through Prozoro, confidentiality can be disrupted, the information can be made public, and we are a reference country for Russia, and we won't be able to reach the efficiency and saving we are speaking about now. So these are key fighters with corruption who initiate the majority of draft laws, and they initiated the verification of the Chamber of Accounts, and the Chamber of Accounts wrote about all the bureaucratic problems, and they provided information, but they say that 38% these are the savings. And this was the fiasco of the committee, because and they shifted the focus, and I have shown here the post of Olga Bogomolets that she believes that we should stop international procurement. Also, first, the register of wholesale and retail prices. It allows to register overpriced medicines, and it should be cancelled. And also some medicines are united in one lot, and in hospitals, what we saw, sometimes they prescribe brand names, and brand names go from one producer, and also schedules for supplies, and also technical specifications when companies compete and the price falls, and if the companies are connected, the price does not fall. So if we are speaking economically, international procurements worked, and those 40% that were lost, now they are not lost. So this is the gender balance here. So Oleksandra told us everything, and for us the most difficult part is the SBU position, because they presented manipulative figures, and we negotiated with the SBU, and some officers, they paid for this manipulation, so to say. So we will continue to defend this reform, and I address people's deputies whom you saw, and to other representatives of the state service who try to kill reform. We will continue to defend the reform. It proved its efficiency. From the start, they said that Ukraine should make its own system of procurement, but we were worse than Africa, because here they stole from the patients, and they said that everything should be done through according to Ukrainian legislation, but we should procure at the lowest price, and this is the main thing. So you have all the details in your reports, and we would like now to have Q&A session. Please, if you have questions, please ask. Introduce yourself first. Good afternoon, Elena Metsipoch. I represent charity Foundation Krona. And how can you call these procurements efficient if you didn't mention the amount of funds that are spent by charities and the parents of cancer that were spent by parents of children who are cancer patients. So we say that we have some budget that is used. So the question you raise, we've highlighted it in our report. We stated that only 50% is covered by the state. So these are the requests that are submitted efficiently. And 20% this is in adult oncology. Whether these figures are representative, we take it from the ministry documents. So the matter is, it's not about this coverage. So in 2016, when did this supply start in 2016? So what were the savings for children and for charity organizations? So this is my press conference, sorry. You can hold your own press conference and express your own opinion. So you asked a question and I want to answer it. So last year we didn't have the head of the ministry, and the contracts were signed only in November and December. And this was the problem, why the supply was in delay. But this is not the issue of international organization. This is the organization of actions inside the state. We waited for a minister for 9 months, and this year the majority of contracts were signed in the summer. So in the summer, you say, right? Oh, one more question. So there are other people who want to ask questions. You manipulate the figures. No, this is done by you. And Olena, so you asked your questions. Here we assess economic feasibility, and we have shown this. So, Olena, if you believe that it would be better to buy at the price of $90, maybe you should explain this to people who get the treatment now and didn't have it previously. Do you have questions, dear colleagues? Yes, there is a question. Vitalii Verdiyanka, Association of Innovative Medicines. Your attitude towards the organization that should be created, and what risks do you see when the procurement will be handed over from international organizations to special service. So the Ministry of Economic Development and Trade expressed the opinion that we should create a single agency, and it should procure everything, not just medicines. And they believe that there should be a concept adopted by the government, but the position of our organization that the most efficient way to buy medicines through international organizations, and we should also deal with many issues such as bureaucracy at the Ministry of Healthcare, and also blocking by people from the ministry who worked there from times of Bogodaryova. They block some decisions, but whether the agency will be able to start efficient work, and we should create a pilot, and we believe that the most efficient way is to procure through international organizations, and such an agency and its creation, we believe that this does not have proper grounds. So we close the official part. So we will continue off records. Thank you.